spend the next 10 minutes or so giving everybody an outline of the evaluation, but put it into context a little bit as well. Into context, so as I kind of mentioned the word health systems, I'm very much thinking about health systems. And that's what interested me in relation to health literacy. As well, hopefully we will come to understand, we already believe health literacy is not just an individual trait, it's a health systems concept. It's about the interaction between our individuals, our organisations and our systems. And that's what I'm most interested in, is actually trying to have a lens into that. And this is what evaluation does for us, is trying to understand that. I'd like to put that lens a little bit initially, then talk about evaluation, the context, the key achievements and some recommendations, and then give you a brief preview in terms of what we're doing this year in terms of the evaluation activities around health literacy. That picture of that person who's in between the two, I guess, abseiling or trying to, is really my attempt to think about health systems design. I think we have a federal government now, and I won't go there, that's making lots of, there's a lot of conversations. But I truly believe health literacy is a concept that can bring not just systems, but people together. People is what I'm interested in. Health workforce is the face of our health system, and health literacy is key to that. Okay, a little bit of context. In 2010, Lucio from Harvard led a commission, health commission, into health professionals' education into the 21st century. Julio's main vision was to create all health professionals in all countries should be educated to mobilise knowledge, to engage in critical reasoning, ethical conduct, the confident to participate in patient population-centred health system as members of locally responsive, globally connected teams. This piece of work with CH, with Western Health Region and HealthWest Partnership is part of that global movement. In that global commission, health system challenges was repeated over and over again. Professional differentiation, population demands, technological innovation, equity law. We probably all know about this, yes we know. But what Julio was really focused on was educational training for the future, levels of learning, and he talked about, or that commission talked about, multiple 25 countries I think it was, talked about different levels of learning, formative and transformative. That's where this health literacy short course, this course fits into. It's about transformative, it's about developing leadership attributes and change agents. That's the lens that we put on this in terms of the evaluation. To build the capacity of health and community services to implement health literacy concepts and practices within their organisations. Not an easy challenge to develop change agents in this world, to actually support these leadership attributes, transformative change, and I'll probably say that a number of times in the next couple of minutes, but that's what it's all about. Our evaluation context was really to attempt to evaluate the adoption and implementation of health literacy course. I say attempt because to me, evaluation is a means, it's not an end point. We have chosen to work in an integrated planning, implementation, evaluation approach. So we feed back into developers, people who are conceptualising courses like this, and into the future. We use a realist evaluation framework. What works for whom and in what circumstances? The road is very symbolic here. It's about strength-based evaluation. Anybody who knows me will know me as an optimist. That doesn't mean I'm always positive. It means that I choose to see optimism, that there is solution. Let's focus on problems, but actually let's look at solutions into the future. We use a variety of surveys, pre-course, we have interviews with presenters, participants, and then a validation workshop. And in all ways, Louise Grease, I have to thank, was my colleague in this author. We wanted to understand about assumptions, about implementation, about factors that contributed, what impacts the course was having, and ultimately about sustainability, because the course was a catalyst, a means. Okay, some of the key findings. And I'd like to start off with a key quote that to me embodies this notion of transformational change. I thought the presenters were great. I'm actually a huge fan of the course. I think the stakeholders that participated were fantastic. They were varied across the sectors. I've been part of the process and part of the training was a real privilege. The reading materials were very enlightening, so it's been a wonderful experience. I think it's made a real change in our organisation. So this is from an individual that participated, talking also about their organisation. And again, it's that dualism between individual, organisation and system that we have the lens into here. I framed in the report 5 key achievements here around workforce development, leadership, partnerships, resource and organisational development. And each of these, I think, the report gives some glimpses, and we've started to write about this in a publication with our colleagues as well. This workforce development, there was health literacy know-how, but not just that know-how, it's that ability to be able to advocate, to discuss, to understand. It's not just about reciting what was in the courses, and that's a challenge. Leadership, not as in a position, but a mindset, advocating. Partnerships, networks among participants, and that's again, Gail will be talking about community of practice, which is one of the lead-ons from this. Resources, around tools and frameworks to apply health literacy practices. And lastly, organisational development, probably one of the most difficult. The development of policies and procedures to authorise health literacy. So it's not just individuals, it's not just an organisation, but it's a systems concept. So that concept of authorised environment was critical. Our evaluation identified a range of enablers that are relevant at an individual level, organisational level, and at a systems level. And I just listed a couple of these. Participants talked really quite a bit about executive support, how important that was. Access to expertise, and alignment with roles, organisational plans and systems were vital. And one of the key enablers that we're really focusing on quite a bit, and community practice is one of them, but also with one of our Masters of Public Health students. It's not here today, but Jagannath Sharma is focusing on network. As one of the key enablers was building the networks with other participants in the course. That's what people told us as we evaluated, that's what we're interested in, is understanding, well, how does that work? What role and contribution are those networks having for those participants and their organisations? As always, with any enablers, there are barriers. And people know me, I choose not to focus on the barriers, but there are challenges. Time, work plans, organisational change, and the most critical, how to implement. There was a thing throughout the interviews that the course needed to be more implementation focused. That was the idea behind it, but again, that was that constant thing. We really do need to have more how to. Perhaps it would have been good to see some more practical examples was one of the key quotes. I'll focus on that a little bit. But overall, the course, again, the mix of participants, the actual 4 modules was optimally supported. It was valued. It was important to have the modular and the projects. They came through solidly. We have, from the evaluation, I'm just giving you a little bit of a snip, 4 key areas as far as recommendations. Firstly, about implementing health literacy practices. So again, revving up what is actually being done this year, of course, in terms of the more how-to. And we've suggested some possible ideas around quality improvement, FOCO. Health literacy community of practice. Yes, knowledge transfer and exchange. It's a continual process. And again, Gary will talk about the community of practice. Implementation enablers and barriers. We've talked about in the report how these enablers and barriers are not just static, they're living context. How can they be better used in the planning, implementation of the actual course, in the discussions, in the projects? It is living material because it needs to be context. And lastly, the value of health literacy courses. That is one of the areas I think that's relevant to any professional development, but I'd say even more so in this area of health literacy. What is the value? It seems to be it's been beneficial, but it's a means, it's a catalyst for transformative change. So we have started on a track with another Master of Public Health student. Lynn is here. It's Lynn, just in front here. If I may say, a pharmacist who's doing a Masters of Public Health is helping us doing a literature review in this area, trying to understand what frameworks exist to really engage this idea of return on investment or the value. And with me, Carl, we have some other plans in the pipeline to develop a full-blown grant at the moment to really get into this area. Because it is important to yourselves, to your organisation, and to your overall stakeholders. What is the value? So that's just a quick snippet. In terms of the 214, there is a course this year that's been run around health literacy with another 10 organisations. there is the health literacy community of practice. The visuals there start to give you an idea. We're interested in this ripple effect. As we said, the course is a catalyst for change, transformative change. It's not just a splash, but it's actually a ripple. So our evaluations will be looking at definitely at the course this year in terms of the implementation. We'll be looking also at the community of practice, the assumptions, how it's been implemented, what the perceived impact, but also at using this concept of most significant change, stories of change from individual participants from last year and this year, and their organisation CEOs, to really capture what has been the impact of that. The ripple effect. This won't start or stop, it's a process, and that's really why it's a health systems concept that we're most interested in. I'd like to end with a quote, but a very, very positive quote. It actually makes us think about how we might present it to other people. It gave us an insight into our own understanding of it and how we can express it in a bit more of a nutshell. So it compacted it being health literacy, so that it was easy for us to express what health literacy means. From that quote, I can tell that this has been a personal journey in this one participant. It's given them the tools, but also the capabilities. It's not just about building competence, knowledge and skills, but the ability to apply, to use with colleagues, to discuss. I think this provides real insights. This is a scent from Waterfield down South Gippsland. The tide isn't going out, it's actually coming to meet us, and we, I think, need to make the most of this. Thank you very much for this opportunity, and I look forward to hopefully meeting everybody later. Thank you very much.